Well, you're just getting old, and that's what happens when you get old. Well, I was 40 years old. 40 years old is not old.
Jeff Nuziard is the founder of the Sexual Wellness Centers of America and the innovator of REGENmax, the patented protocol proven to cure and prevent erectile and vaginal dysfunction. More than 3,000 patients have completed the program with outcomes that consistently reflect a remarkable 97.2 success rate, first demonstrated in his clinical trial. His work began with personal experience because at 40, Jeff faced erectile dysfunction himself and found that pills eventually stopped working. Instead of accepting decline as inevitable, he approached this problem differently. Free from the confines of traditional medical training, he asked questions others were not asking, which led to 15 years of digging into white papers and research, conducting cadaver studies, and testing ideas with physicians willing to challenge convention.
My mind was very sexually driven, and my body was saying, I'm not cooperating, I'm out. There's a real problem. I don't know what that is, but I'm gonna find it. I really started digging deep, and when I say deep, I worked with cadavers, I worked with pigs, dead pigs, and cut into the tissue. We lose testosterone, and that activates the aging process. The cause of erectile dysfunction is not blood flow. It took 15 years to figure all this out.
Hi, everybody. Welcome to another episode of the Libido Lounge. I'm so excited to invite Jeff to this show because today we're talking about something that I actually just wrote this long email about over the weekend that is a topic that continually fires me up, which is age. And this whole thing that often happens where when we start aging, we start having things come through our head. And oftentimes these are from medical practitioners, which is, I am just getting older. And many times when we start having symptoms, we are told this by our friends, we're told this by our family, we are told this by our doctors, and we ignore symptoms so often because we just think that this is normal. We think our friends are going through it, so obviously we are too, and we then stop looking and researching for the why. And these symptoms, when we're talking about sexual changes through erectile dysfunction, through vaginal changes, these are symptoms. And while they commonly happen with age, it is not necessarily because of age. And even if it is, there's still things we can do about it because there are root causes. And that is why I wanted to invite Jeff to talk about this today, because we got to get out of this thinking that it is just because of age. That is doing so much damage to us, to our health, and to our relationships. So Jeff, thank you so much for joining me today. It is a pleasure to have you on the lounge.
Thank you. I'm excited to be here. I've listened to your podcast several times, and I'm excited to be here. Thank you.
Fabulous. It's my pleasure. And so, let's start about this. What do you talking about this as far as age? What do you think is going on from a root cause perspective, especially with ED? We'll start with ED, and part 2, we'll get more into the female side of things. And what do you think is what's happening here? And why do you think so often it's just okay, we would get prescribed the little blue pill and it can work sometimes for people for a while and stop, or work acutely and not fix the chronic problem. So what is going on here, and why are we just often saying it is age and telling people to deal with it?
What a great question. And I love your intro because that's exactly what I was told verbatim. Well, you're just getting old, and that's what happens when you get old. Well, I was 40 years old. 40 years old is not old. I mean, my mind was very sexually driven, and my body was saying, I'm not cooperating, I'm out, So the pills, I did what everybody else does. I started looking at hormone replacement therapy 20 years ago, and maybe that's a problem. And it was. My testosterone at 27, I know for a fact, was 1185. And then at 40, just 13 years later, it had dropped all the way to 305. So that's what got my curiosity up. What caused that, number one? And why don't the pills work anymore? What's going on? And so I started digging deep, and for years, everybody's chasing blood flow. Thus the pills, thus the topical ointments, pumps, and take nitric oxide and do this, do that. There's so many gimmicks on the market and more today than there were 20 years ago, but there were still quite a few. And I'm like, listen, there's a real problem. And I don't know what that is, but I'm going to find it. And I started reading white paper after white paper, I mean, hundreds. And they were all saying the same thing. And there was one common denominator that nobody was addressing. And I've got a very extensive laser background, and I understand laser medicine very well. I've got a master's in laser physics. I'm very well versed in medical lasers. And I'm looking at all this information, and I'm like, listen, everybody's talking about a lack of collagen in the penile tissue. Everybody's talking about the degeneration of collagen, and we're assigning it to age. Okay, which didn't make sense to me because I knew 70-year-olds at the time that had no problems getting erections, which made me feel horrible at 40. Like, why am I? They're old. I'm not, you know. And now I'm 60. They're not old either. But
Yep.
back then that was my mindset. So in that process, I really started digging deep. And when I say deep, I mean I worked with cadavers. I worked with pigs, dead pigs, and cut into the tissue. And I got to figure this out. Lo and behold, it's traditional medicine teaches that we age and lose testosterone. But that's not true. What happens, we stop producing testosterone by about 2% a year somewhere in our 20s. Now, obviously for me, it happened after 27 and was a whole lot more than 2% a year to be down to 305 in just 13 years. But what I learned is, and I'm just going to use round numbers for conversation's sake. Let's say your prime level testosterone was at 1,000. And as it's coming down, it gets to 600. That's an activating point. And let me explain it by making it real simple to understand, give you a little picture here, a mental picture. And that is, think of your body like electrical box at home where all your breakers are. What happens, your testosterone hits that 600 or 500, that level is unique for everybody. That opens the door to your electrical panel and starts turning breakers off one at a time until the final breaker's turned off and you expire. That is the aging process. But what it is it started because your testosterone hit a certain level and that opened the door, that activated. So contrary to Western medicine, we lose testosterone and then we age and then lose testosterone. We lose testosterone and that activates the aging process. So once I started figuring that out, I said, okay, so then what about this collagen stuff? Well, guess what the first breaker that gets turned off in your body is? Production of collagen. So as that breaker gets turned off, it happens to men and women same time, same thing. It's just women notice it because women are in the mirror every day and they go, hey, where'd that line come from? Where'd that wrinkle come from? Men, we don't care about stuff like that. But nevertheless, it's happening. Inside the penis, two tubes called the corpus cavernosum. Inside of that is a spongy tissue called the spongiosum. That spongy tissue is responsible for absorbing all the blood that flows into the penis until it hits a level in that penis that activates a muscle behind the scrotum called the bulbospongiosus that squeezes down, locks down the blood that's in the penis until orgasm. Then that muscle relaxes, blood flows back out. So that sponge is held together by collagen. So what happens is the sponge starts getting not very effective. It's absorbing less and less. And so people don't really notice it because it's so slow. It's over a time process. But the first symptom of erectile dysfunction, and I hear it from every patient, the first symptom of erectile dysfunction is I can get erect, but I can't maintain it. And now it's getting harder to maintain it longer, and it goes down way quick. Sometimes I can't even penetrate. It's already gone down. And that's because the sponge is getting more lax and more lax or more dried out because the collagen is degenerating. And if it doesn't get full enough, it doesn't activate that muscle and it creates what's called medically as the venous leak. So once you start that, then our bodies are really, really good at overcompensating for injuries and problems. So your veins say, hey, Mr. Sponge, you're not absorbing all the blood we're sending in. So they help out. And they develop atrophy and shrink up to send less volume of blood in. So now you got a 75% erection, and then you're still not absorbing it. So your body reacts, and now you got about a 50% erection. To eventually, I got people who come in at various stages, but they come in and I meet with them in a consultation, and they tell me, at best, I got 30% erection. And then I got guys that tell me, I get about a 75% erection and it doesn't stay there. This is all over the board. And then, have you ever had your testosterone checked? No. Okay, well, we need to talk about that. So we just kind of go through the process. But the cause of erectile dysfunction is not blood flow. It's a decaying sponge from decaying collagen. A result of erectile dysfunction is less blood flow. So I said, okay, let's walk that backwards. Let's not worry about reversing the blood flow if I don't have a sponge to absorb it. Let's how to figure out the sponge. So many articles about degenerating collagen and lower collagen levels in the spongy tissue with testosterone deficient men. Okay, this makes sense. It's all starting to click together. So I knew what I had being in laser medicine so long. I knew what I had to do. I knew how to remodel collagen. I do on women's faces all the time, but on a penis, I don't know. I got to figure this out, And I always joke and say I won't admit or deny that I burned myself and a couple volunteers a few times trying to figure this out. But eventually I figured out it takes a special kind of laser to remodel the collagen. Once we get that tissue, the spongy tissue regenerating, well, then we can create angiogenesis in the penis, in the corpus cavernosum, and develop new blood vessels. So we get rid of the old, bring in the new, get rid of the old sponge, regenerate. It's just like lifting weights. When you lift weights, you tear your muscles down, and your body at the cellular level rebuilds them. So that was, in a nutshell, the premise. And it sounds like it didn't take very long, but it took 15 years to figure all this out. And because I kept chasing all the same stuff, and I kept going down rabbit holes that everybody else was going down. And it's really interesting how some of the most simple things are right in front of you, and because they're simple, you overlook them. So that's kind of the story behind it all. And I'm going to tell you, when I figured it out, I saw results within 3-4 treatments of myself. Then I got a couple guys to volunteer at no cost, and they started getting results 4 to 5, 6 treatments in. And then I said, I'm going to do a clinical study on this. I developed a biologic that we inject one time, because O-shot and P-shot, they've been around forever. Dr. Reynolds, Fairhope, Alabama, invented it. Back then, that's all we knew. But what I didn't like about it was, number one, if I were to do that today, I'm 60 years old. Well, my stem cells aren't very good, or my exosomes and my PRP is not very good. They're old. So I needed something more regenerative, younger, better, that was just more regenerative. And the other thing I didn't like about the P-shot is it's 5.5 ml injected into the penis. That's a lot of volume to go into the penis. So it's very painful. And then to do it right, you got to do it 3 times, 2 weeks apart. And nobody sells it that way. None of these med spas and all, they don't sell it that way. It's one one shot. It's not going to help. It's not going to work. Same with women. Shoot, women get 2 ml in a clitoris. Wow. Talk about volume pressure. So, yeah, all that was developed, and then I did a clinical study on it, and of 250 patients, and had a 97% success rate, 97.6 actually. And now we've had over 3,200 patients since we've been open on a retail clinic side for 6 years, and we've had over 3,200 patients go through the process, and we've maintained a 97.2% success rate. And it's the same story, different day, different man, but all the same stories. And I'm telling you, we're seeing results on people who had complete prostatectomies from prostate cancer, from radiation from prostate cancer, and it's been rewarding, and it's so fun to give people their life back. I can't tell you the emotional strain I went through.
Sure.
At 40 years old, oh my God.
Sure. Yeah, I love it so much. And I want to, I have a couple follow-up comments and question and a few things to say here. But the first is, like, I do so value like the level of research you've put in this. And I think it's so wise. Like the idea of continuing to ask why, like, okay, well, why does this happen? And why does that happen? And why does that happen? I really think that's how we get to the root, is continuing to
Exactly.
ask that. And so many people are not. So just kudos to you for doing that. I want listeners to know that in addition to all of us, like, I am a big fan of getting to the root and giving something that can support you right away while you're getting to the root. And just so everybody knows, one of my favorite devices for this is the LUXIS. I'm going to put a link to this as well as all of Jeff's information so you can get a hold of him in the show notes below the video. And this toy is amazing because you do have this cock ring that can help to keep blood in the penis and can help with that in the acute time when you need to have those erections. But the most amazing thing is the female part, which this goes around the woman's thighs and sits with this part here right at the clitoris, and this vibrates. So she can keep this exactly fully in place, tighten it up around her thighs. In any position this is vibrating, so she gets that clitoral stimulation, which is incredibly important because less than a third of women can actually orgasm from penetrative sex alone. Majority of women need that clitoral stimulation. And when he's wearing this, which helps keep blood flow in it, this has a magnet which stimulates this other part. And what that means is that when he is getting closer to her or faster, it's actually controlling her vibrations. So
Oh, wow.
while you have her in any positions, while there's that blood flow, she's still going to be able to experience her clitoris being stimulated, which is going to help with that orgasm gap and all that. So just wanted to throw that in there because I think it's a super important point for people. And one of my questions for you is, like, because it's so interesting, I find, in the sexual dysfunction world that we almost like make men and women into these different categories oftentimes. And we
Uh,
think oftentimes in medicine, like, well, these are male problems and these are female problems. And I know you and I both know that when you get to the root cause, it's a manifestation of this way
yes.
in the man versus, the woman. But it's like some of the similar root causes. And as you're talking about, like, this lack of collagen and, what's going to happen with the spongy tissue and all that with these changes, one of the things I'm thinking about is, like, as far as the health of the pelvic floor, is that you're getting like that
Yeah,
lack of elasticity, right? That's what you're describing. We see that for
absolutely.
women, that's a huge problem. So I'm curious, just about your protocol. Like, are you helping, like, do anything to kind of work with that, increasing that elasticity of those pelvic
Yes.
floor muscles in men? Can you talk a little bit about that?
Yeah. So with men, it's important to exercise that bulbospongiosis, because as your sponge is not getting full and activating that muscle, it's like every other muscle that you're not using, it gets atrophy. So male Kegels are very, very important. Very important. When I realized that pills, when I got onto the sponge part, like, it's not filling up and there's a problem, and the pills weren't working, that's what drove me to the sponge research. Because when I read that there's lack of collagen in testosterone deficient, all that stuff, the pills were starting not to work, which is proof, because those pills work. I don't care if you get an erection or not, they dilate vascularity. I know a lot of physician friends that prescribe those for stressful jobs. So you're having a bad, stressful day for air traffic controller, take 20 milligrams of the Cialis and it'll create blood flow. A lot of things like that. And they work, they dilate vascularity. But what good is that when you don't have anything to absorb it? So the body dilates, sends a bunch of blood in, and every man tells me, well, when I take them now, I get a little firm, but there's no erection. Well, why is that? Because they're working. You got a bunch of blood flowing in, but not being absorbed, so it's flowing right back out. So that is the problem. And with women, people understand the only difference between a penis and a clitoris, one has a urethra, one doesn't. And size, obviously, but they have the same corpus cavernosum, the same spongiosum. It's the same. Look at a cross section of a penis and a cross section of clitoris. So I was like, wait a minute, if this is helping men, I can restore clitoral atrophy. So we started working on that. Lo and behold, women respond very quick. The problem is with women, they get, and we'll get more into this in part 2, but women go through more than just that. Yeah, they have ED, quote unquote, with their clitoris, but they don't really realize it. But when that's happening, that's destroying clitoral nerves and sensitivity. So there goes your sensation, there goes your orgasm, and then what happens is, as you talk about the pelvic floor, when that relaxes, women go through what's called vaginal relaxation syndrome. That vaginal canal drops, and when that happens, the rugae that line the vaginal canal, that's what creates the wetness. So when that canal drops, those rugae go flat, and they're not on edge anymore. And then now comes the vaginal atrophy, the dryness, the pain. It's a domino effect. And so pelvic floor health is so important. And it's just like every other muscle. When we stop using muscles in our body, they get atrophy. Why do sedentary people get weak? And they say, like, when you're old, like 80s, late 80s, they say a fall is likely, and the fall is the beginning of the end. Why is that? Because their muscles aren't being used and they don't have the support. So it's the same thing. If we don't exercise that pelvic floor and work that, we're going to get atrophy. It's going to be a problem.
Yeah, thank you for explaining that. And we will go through that from the female part so much in part 2, you guys. So below the video here, you're going to find coupon codes to the LUXIS, like I talked about, for getting discounts. You're going to find how to access part 2. And I know after listening to this and realizing how unique Jeff's approach is and how much he knows, like, I interview so many people. I think I'm close to, I don't know, I think we're on like episode 120 at this point. And you are definitely saying things on this episode that nobody has said before. It's just absolutely wonderful. So I want to make sure that people know how to get a hold of you to check out your work, to get started. I know when people come in, you offer a free book too when people take you up on that first visit. So can you tell us a little bit about that? And you guys will have all of this information that Jeff's about to share here, and like the links, all of that below the video for you all.
Yeah, I'm proud of my story. A lot of people get embarrassed about ED, and I can't tell you how many people say, well, I don't have that problem, but my friend does. And it's just, they're embarrassed, and I get it. But guess what? You cannot heal what you're afraid to reveal, right? So we got to talk about the problem. But so I finally just said, I'm just going to write my story it's a small little book. Take 30 minutes to get through, but it tells the story. It gives the science background of it, the success of the treatments. And I'm 60 years old now, and I am never been more proud of my age in my life than I am today. I turned 60 in October. I'm healthier than I've ever been. My blood counts are perfect. If I gave you my blood, my labs, you would think you were looking at a 25-year-old. I mean, my blood is perfect. My hormone levels are great. I have more energy than ever. And it's because of this experience and realizing how to connect the dots and how to get better. So I just put it down in a story format and put it in the book. So yeah, when you come in for a consultation as a patient, we give you a free one. And especially, if they decide I can't afford this or don't want to do this or whatever, we just give them the book anyway and tell them thanks for coming in. And when you're ready, we're here.
Amazing.
So we just want to make it available. It's really important. I can't tell you the emotional strain. Women can kind of close off to it a bit and kind of program their mind like, I don't get orgasms, it hurts, I don't want to. So they just they're strong mentally and they're able to just shut that off. Men, you take a man's penis away, I tell people all the time, I felt like I had to turn in my man card. I was done at 40, and it was embarrassing, it was humiliating, depressing as heck. And so it's just important. I can't tell you how many people tell me, thank you for giving me my life back. So it's very important.
And thank you for ending on that point, because even the term, like, this is something else I say a lot, is like, even the term sexual dysfunction, I think is actually really problematic. Like, sometimes I will say that just from a medical perspective, but I really think it like does disservice, especially for men, about talking about it, because what we're really talking about here is an imbalance. And when we use dysfunction, it sounds like shameful. And,
Yes.
And not being able to get or maintain an erection, while there is a lot of more like emotional and mental and, can feel, my understanding from talking to men is, can feel, like you said, like robbing them of their masculinity. And while all that is emotionally true, at the same time, there's no difference in an imbalance in the penis or an imbalance in the blood sugar. It's like they're just imbalances in the body. The root causes might be different, But all we're talking about is like, oh, the body's out of balance. Let's figure out why. And
Yeah.
so I really appreciate, you sharing your story and taking the shame out of it. Definitely encourage men that if you live long enough, pretty much everybody, due to age changes that are reversible, they're just things that get out of balance commonly when we age, not because of age, just because we live a long time and things get out of balance, that are fixable. And so working with somebody like you is essential. I also want the ladies to know that one of my favorite devices also when we're talking about orgasms, and so many women are like, this is not important to me anymore. But here's a really interesting device, which is the Lioness. And the Lioness is amazing because what this device does is it's a data tracking device for your orgasms. And just like tracking our steps, when we track our steps and we realize, I track my steps, I walk more. When you actually use this and it's hooked up to an app on the phone where you can see arousal and orgasms, well, what their company is doing when they're working a lot with the Female Sexual Research Institute, where they're actually studying this, and they're finding that when women track their orgasms, orgasm quality, orgasm quantity, and interest in sex are going up. So it makes sense. So you'll find discount codes and all of that in the show notes. You guys make sure you go check out Jeff's page. Make sure you get that appointment with him. I think he can extremely help so many of you women. He has something for you too. So make sure you go check out part 2. Men and women, I always encourage you, if you're in hetero relationships, to check out additional stuff for the opposite sex because it makes us better partners, lovers, support, and all of that. I thank you all for listening. We will see you in part 2. Thank you for listening to the Libido Lounge. Please don't keep me a secret. Please share this with your friends. You can find me on YouTube, on Instagram, as well as how to work with me at mylibidodoc.com.